outgoing student and batch topper. She pursued her bachelor's of physiotherapy from the St. John's Medical College in the hospital. Adding to her academic achievements, Dr. Zubiya has also contributed to the scientific lectures. She has also published a research article titled A Study to Determine Levels of Physical Activity Among Healthcare Professionals in Bangalore, which is published in the International Journal of Innovative Science and Research Technology in the year 2025. Uh, Adding to her clinical expertise, she has expertise in the postural assessment and the correction, designing physical fitness and rehabilitation program for all the age groups, and also antenatal and postnatal training. So that makes her the perfect speaker to enlighten us on this important topic mainly for the dental professionals. So let us warmly welcome Dr. Zubiya Naaz to share her insights with us. We welcome you, Dr. Zubiya.
Assalamualaikum. Good evening, everyone. Thank you so much, Dr. Tayaba, for such a beautiful welcome and such a motivation talk. I hope I meet to your needs. Can I start?
Yes, sure. Please start.
Okay. Is my screen visible?
Yeah, it's visible.
Okay. Okay. So our topic for
Yeah.
today is smart ergonomics for dental professionals, preventing strain and injuries. So first of all, I want like all of you to interact with me so that I know how much you know and where should I, increase more of your knowledge. So can somebody tell me what do you mean by ergonomics? Like anything that you know from the word itself. Like anybody can just give me a gist of it.
Ergonomics is basically postures.
Okay, you learn about postures, ma'am.
Yeah.
Okay, so I would tell you in a very simple term that ergonomics is like a field where I'm not going to tell the human or the profession to adjust yourself to the work. You have to adjust your environment, your professional environment, according to your body type or your convention. Like you should not be adjusting yourself or working in a place where your body is not adjusting. You have to alter the place according to your, comfort zone. So always what we do, I don't according to the Indian population, we just want to get our work done. So we do it in any position possible, just finish the work. But that should not be the criteria. Ergonomic plays a role where you tell that you should make your environment work friendly. So it tells you, one second. So now I'll start with the objective. Now, what will you know is from the webinar is like you will get to know what is actual ergonomics. Okay. And then you will get to know what are the risk factors which are leading to the injuries that you're getting. Some of them will you will understand that it's only the posture, but it's not the posture. You will get to know what more things can come into the role for you to get that particular injuries or any of the conditions that you are facing. Then you will learn how to some of the preventive strategies. Prevention is the best cure. And also I'll be teaching you some ideal postures that you have to be following and some positioning when you're treating your patients. And then we are going to cover all of these topics, like all the goals, then what are the risk factors, then how you have to apply ergonomics in your professional life, and what are the equipments, how it has to be basically in a very detailed manner. So now, like how I told you, ergonomics is how you are going to work smarter. You're not going to work harder, which we everybody does in medical field, I feel. So what you are going to do is either if you have the liberty, you're going to choose a tool which is very easily applicable and it is easy for you to use. It's not that it's available, but you have to choose which is going to set to your body type, your hand grip, your strength, and you're not just going to choose it because it's available. Okay, sorry. And then your workstation also, I have seen in so many the experience that I have got from just observing the dentist. The workstation, they do not have assistants, okay? And then they are only fixing the light, they are only bringing the objects closer to themselves, they are only treating the patient, and they do not have their adjustable chairs, the beds, the patient bed. They do not have the height, most of the places which I've seen, if it is a fully equipped clinic, but they don't know how to use it. So either it's this way where it is lagging some information, and it's whether the person doesn't know, or it doesn't come to your mind where you have to alter what and adjust yourself first and then treat the patient, so that your quality of life of providing the treatment and you also do not suffer later on. So it's basically, you have to fit the job to yourself and not the worker to the job. That is ergonomics. Then in dentistry specifically, we are it's like it's a science where you're going to design your work environment, your equipments will come, your task which will fit the individual, like you are the individual here. Now, your primary goal of doing all of this, keeping in mind, is basically to prevent any of the physical stress and strain that you get. Usually, what happens in most of the dentists, the first primary cause will be any of the musculoskeletal disorders. You will come with low back pain, shoulder pain, elbow pain, wrist pain. It's just, it's not because of the experience that you have got and how many patients you have treated. Even the interns that I have seen, after the BDS, the interns, even after a short course of span, they get back pain, they get, shoulder pain after treating. They rest again, next day your body has that healing capacity, you'll be normal back. But you do not know on a long run how much is this going to affect you, until unless you reach the stage that you are not able to do your work. And there are people at very, in research wise, people think of quitting the job because they are not able to sustain after a certain point of time when it has reached that level of injury you have got. So we are going to see all of that. Now, basically, the elements that we are going to include is, you have to have designs. There are a lot of equipments where you can, it's ergonomically designed only for your professional field. And then you have to adopt some postures. I completely understand when I have to talk about postures, when I tell you, you have to sit straight, you have to sit 90 degrees, you have to keep your head like this, you have to hold your elbows straight. Now, when I'm telling you, maybe it will remain with you for 4 to 5 days. But after that, eventually, human tendency, you will get back to the, state where you just have to finish the work. Whether it's a one patient, then you will take a 15 minutes break. Again, you will get that energy and you will be like, okay, let me just finish it. So this mindset of us have to go where we have to be very conscious and do a healthy work where, efficiently work, and quality of your treatment plus your health also should not get compromised. That is the main goal, that ergonomics is very important in dentistry. Now, what are the challenges that are faced by all of you? Is nothing but you have a very static and very awkward postures depending on your height, your body type, and the chairs that you guys are provided. You adapt that postures unknowingly. Then there is repetitive movements. Like, I assume that you do a lot of wrist and hand movements because you do not have to lift heavy patients or something. So you have to do repetitive movements in your profession. Stress of not just completing that much quota that you guys get to finish. And then you are having a lot of patients who are of different group of people. Like, they can be either a medically compromised patient, it can be any age related patient, it can be obese patient, it can be specially aided patients, depending on the patient's behavior, because your treatment goes for more than 30-40 minutes minimum. So you have to manage that also. And then if the patient is not able, very old age patient, who cannot move very easily, so you have to look after that also. So all of this are the challenges that you face during your treatment itself. So how will you overcome this? You have to be very conscious about this, like how to overcome. So everybody knows that this is the problem, but they don't know how to overcome it. And even if you know, but you do not have the support or assistance to do that. Then lone working. This is very common, I think, in dentistry, where I see only one person handling back-to-back patients and one person doing the same old procedure and everything together, if I'm not wrong. Then why should we care? Like, and then consequences of poor, what is your designing, is because of if you have a discomfort, it will lead to chronic pain. Your acute pain today, maybe after 3 months, the same pain is going to become your chronic pain. From your muscle, it will go to your joint. From your joint, it will affect your nerve, and then you will come, go to an orthopedic, and then your long procedures. So that discomfort should be your first sign that something is going wrong with your body, and you have to rectify it then and there. Then you have acute accidents that can lead to your injuries. If you have fatigue, then it can lead to more errors. Most commonly seen musculoskeletal disorders can be low back pain, tendinitis, then there can be inflammation of the tendons, then there can be you are using a lot of shoulder, so it is inflammation of the epicondyles, then carpal tunnel syndrome. Okay, then next we will move. Um, Next is we are going to see why there is a lot of what do you tell? Hello, can you hear me?
We can hear
Yeah,
you.
Zubiya, your
Can't see.
screen.
Yeah.
Okay, one second, ma'am. Just give me a second.
Yeah, sure.
Is it visible now?
No, it's not.
You can see it?
Yeah, it's
Okay,
started.
okay. Okay.
Yeah, you can.
Okay, now, what is according to the research, what is the impact of, ergonomics on dental professions? Like how many, if you have to see in percentages, then in a recent study where I have to tell that all musculoskeletal disorders are 82% of, dentist population are dealing with it. But some of them get treated, some of them do not have the knowledge that it is going to affect them in longer run. They get used to it. Mostly neck pain are the major reported problems because your neck, I see a lot of patient, dentists being a patient, like when you are too close to the patient and literally, I don't know whether for the view or what is it, the dentist is already in, completely inside the patient's mouth. You have to completely bend and see. That is, they don't know like, whether you have to do it for such a long time. Even if you have to do it, then you have to come back, take yourself some rest, that breaking time that is more required. And then because of all of this, there is, a lot of early retirements according to the research. What are the risk factors? As I told you, there are prolonged use of vibrating hand tools that you guys use in, all your field. And then there is static neck, back, and shoulder postures. Same position, like literally you guys sit like stiff bodies for 30 to 45 minutes. So it is a very bad posture for any human, any profession actually. Repetitive motion, like you do scaling and polishing. Then there is grasping small instruments for prolonged periods. All the instruments that you have that you use for scaling and all, and excessive forces for tooth extraction. So these are the major risk factors, and I think these are the major role that you guys play, and all of these are very important. In everything there is a risk factor for it's caused. So what will be the ergonomic goals that we are going to see is basically, according to as a physiotherapist, what we have to see is we have to eliminate your unnecessary tasks or any steps which is not required or which can be done by somebody else. For example, if I'm a dentist and if I have an assistant or if I have some help, then I have to have that mindset that when I'm doing something and I need something, I do not have to move or go very far away to get that object. I need somebody's assistance. So I'm going to eliminate all the unnecessary movements, which is going to harm my spine. Okay, because I'm going to rotate one side, my patient is on the other side, and I'm going to take something from very far. I'm going to get up, I'm going to do that again, come back, position myself. So a lot of energy consumption. And then the steps which is not required. For example, if your procedures are very long, like, if I don't, I'm sorry, I do not know the detailed procedures of yours. I'll just tell you very superficially. Even if you're doing RCTs or something, there will be some time where you can relax. You can go back, make your neck straight. You can continue again if it is possible to do it. It's not important for you that 30 minutes or 40 minutes you have to stick to the same position and time and do it. You can break your treatment time, you can elongate your treatment time if it's whenever possible, and then reduce the potential for overexertion injuries. You are not going to exert yourself more than your capacity. This, everybody has their own capacities. The seniors will get trained more, so as time goes their capacity might increase, and they will be like, okay, this is normal, I can do it. This is your mentality that you have gained so much power by time. But nowadays that I see my young dentists also, after some like very initial years only, they'll be like, after doing that cleaning process only, after 4 to 5 patients, they are done for the day. Okay, then minimizing mental and physical fatigue. You have to divide your work in your department within your group, so that one person is not getting bored. This also plays a lot of role. When only one person is working for the entire day, so that person is fatigued, that person go back with a low back pain. Next day, some other person will be, treated like that. So it's better you equally divide and share. So this is also an ergonomic when it comes to an organization where everybody is equally dividing the work and everybody gets trained equally. Okay, and preventing also equally. Then we have leverage working skills and knowledge of the time, so that now in this part where what we do is, you have, like, for example, scheduling is also important. Like, we'll deal with each of it in separate ways. For example, if I have to tell you, how are we going to divide this, it's basically your instruments, your equipments, your work postures. So now in instruments, you're going to your hand instruments and your vibrating hand pieces. So each of it, when you go in detailed and comparing with your experience, you are going to know what is the best hand instrument that is suiting for your hand. Some might have very tiny and minute hands, some might have very long hands where you can hold it. So it depends on individual. Like, after assessing from a physiotherapist point of view, I would like to tell, like, when I'm assessing you, I would like to tell you to show me what is your grip strength. Depending on your grip strength and you holding it how precisely, I will tell you, okay, this is better for you. You try out with 2 to 3 patients. Once when you do, you will get to know which is actually comfortable for you, because it's not just about holding precisely, but it's also about holding that same thing for a longer duration of time. So according to your body type, you have to analyze it and you have to stick to that. Whatever is available, we are not going to use that. Whatever is suitable for you, you have to choose that. So that thing has to be, that is the criteria that you will create for yourself. And then vibrating hand pieces. So here we cannot do anything, but you have to use it, but you just have to do so that you are not exposed to the vibrations for a longer duration of time. Whereas if we have equipments like lighting, magnification, I don't know how improvised it is in India for your profession, or how modernized it is. But whichever, according to your, as you get experience, you will get to know which is better for you. And operator and patient chair is very, very important. Then patient position and your position. Now, when we deal with individual things, so we are going to see for the tools and instruments. So this is, can you see this image? Can somebody tell me if they can see the image?
Yes, yes, doctor.
Okay. So now what is the
Yes,
goal of our tools or instrument is basically, it is to reduce your force exertion. The thin the hand will be, or whatever you call it, and precisely you're holding it, the more thicker the band is, the more grip you get, and the more ridges. It's called knuckled surfaces, where you have the shapes and it's not slippery. So your surface area of that instrument also should be such huge that according to your hand type, you should not be exerting more. Because I see when the procedure scaling, when you do it, you have to be very precise and you have to do repetitive movements. So you need to know that your grip has to be more precise on the instrument. And then your hand and wrist in neutral position. It's not very sure that you will keep it in neutral position. It's consciously it doesn't come to you, because when you are into the procedure, this is the main thing. So how will you overcome this is by choosing a right object or the instrument that you have. the size and shape also matters. I told you how you are going to experience yourself and do trial and errors and get it. And then your handle shape and size. So this is one of the image that I got. So I don't know how, in different setups, I have usually seen this carbon, material things. I have never seen this kind of, instruments where maybe you guys have used it. So here it is a very thicker handle. You can see the person holding it. You do not have very, tip holding is not there. It's like you're holding it like that, and you have a bigger surface area. So your grip is bigger and you're holding precisely. You don't have to concentrate too much. Your movement is not very less. You have a bigger surface area. Your tactile sensitivity will also be more in this. So you have a better responsiveness. The weight of this also is like, it's ideally told according to the research, is like it has to be 50 grams. It should not be more than weighing 50 grams. And then you have to balance it out. There are also devices in this, the instruments, it is foldable. I have a photo of that, I'll show it to you. So it has to be very lightweight. It has to be, metal to metal, and then it has to be very durable. And it is also, the hygiene is also maintained in this because it's silicone surfaces. And then what do you mean by maneuverability? It is basically you have to maintain the quality and the ability of that person to move it very easily. That's how the ergonomic, this company or whatever the people are there, they have designed it in that way, so that even it's not like very fancy to see, but it's very, according to the dentist's research. So a lot of people have told that if your surface area or the ground is bigger, your holding area becomes bigger, so your grip becomes bigger. You don't have to concentrate. First of all, holding, if it becomes very difficult, then doing the procedure also, it will be slippery. So that's why that ridge is also there. So even this minute things matters a lot when you're doing it for a longer duration of time. And then ease of operation. So now this is basically how you are going to make it simple. You're going to make it very user friendly, and the product also has to be user friendly. And then how you're going to make the process is to use it around you. So what you're going to do is very minimal training is required. You don't need training for this. With your experience, you get it. So when you are achieving the goal, is basically whatever operation or thing you're doing, it has to be easy. That is the main goal of using an instrument. Then ease of maintenance, like sterilization, and it should not need that big maintenance thing for you to use it. So it has to be either use and throw, or it has to be very reusable. See, this is the one that I wanted to show. It is very durable. It is very flexible. So it's called resin handles. You can see that ridges, what they have made for your holding grip. It is round. It is knurled. It is compressible handles. It is very flexible according to your position, however you want to. And then it is also, carbon steel, which is the made component which is used in your equipments. Now, what is the, dental stools? Dental stools are very important. It's not just for, this is the patient stool, not just for the patient, but also for the therapist. Like the dentists. I have seen dentists they have the chairs without a lumbar support, like without a back support. Even if the dentist has the back support, but I don't know why they do not position themselves to take the back support. I always see all the dentists either too erect, too inside, or too focused onto the patient, and they are not relaxed. Either maybe during the procedure, if you're not able to do it, but I would suggest you to just go back for maybe after 15-20 minutes, and then again come back to the position. You can definitely do that. So it's just both the ways. It's your patient chair also, because from my own experience, I would like to tell, the patients slide down, because it's always 90-90. My body is like this and my legs are completely straight. So after some time, the patient slides. I was one of them. So when you're positioning the patient, make sure you position the patient with the lower end little bit inclined, so that the leg end has to be at least 30 degrees bent from the knee, so that the patient doesn't slide and you don't have to keep positioning the patient again and again. So even in some hospitals that I've seen, government setups usually, they do not have this automatic adjustable beds, where from the dentist have to be operatable from the legs itself, like where you can increase the height, the inclining, the patient, the self chair. So this is there, like this is the improvement, but I've never seen somebody using this. I don't know what is the lag there. So you have to have straddle stools with adjustable height and lumbar support, as I told, so that patient is also positioned properly, so that you are comfortable, that patient will not move. And then you also have to increase your height. I've seen very tall dentists who are there. The chair is very small and their legs are completely out like that because they're very tall enough. They can't increase the height of the chair because they have those typical stools without the, raising hand. So it is a very big problem for them. And the people who are of medium height, they cannot position the patient down because the bed is not going down. So that is also a problem. So all of these things, it matters when it comes to your health and your positioning. In magnification, in very modernized private clinics, I see the dentists are provided with a lot of screen, like whatever you're doing, this it will be displayed on the screen. That I have seen one equipment. But I don't know, maybe all of the dentists are prone to so much hard work that you are not, educated, or but you're not tending to use the technology that much. I still see people, getting inside, entering, and not using the equipments when it is provided. Maybe because you are, not well equipped with, or you're not trained with it, or I don't know where is the lag in that. But I would suggest whatever is provided to you, to understand, not just as Indians we come into using jugaad sometimes, and just getting the work done. It's okay if you take 15-20 minutes more, but don't compromise on your quality of life when you're not compromising on the patient's quality of treatment. So you have to, when you're using no magnification glasses, you have to reduce, your head has to be tilted, but you should not be tilted more than 30 degrees. Now, when I tell you 30 degrees, everybody will be considering how much. How will I know whether I'm, bending that much? I should bend more. How will I know? So I would tell you to, suggest you to see on 2-3 patients when you're actually treating the patient. When you're treating it, after some time, if the position is wrong, okay, and if you know that it's going to strain you, you will definitely feel a pull in your neck. This is your body showing you the sign that somewhere you're going wrong. At that point of time, take it as a signal from your body. Make it straight. Leave the patient. Relax. Okay, I will teach you some movements later on. Relax and then go back to the same position. Then you will know that how much you bent before, you are not going to bend that much. So this is your self correction. Okay, I hope I'm clear. And then, as I told you, for the hand pieces, it has to be under 50 grams. It has to be very balanced, very low vibration models. So, and you have to minimize, so that it minimizes your wrist and hand fatigue. Moving forward, very important is scheduling. As I told you, in a setup, you have to have a recovery time for all the staff, so that even the students, I would say, what are the strategies that you will use? You have to increase the treatment time for most of the patients. Wherever the procedures are going wrong, I told you to break the treatment. In case there will be people where, like, you have 15 patients to finish at one shot, what to do? You finish one patient, give the second patient to somebody else, you come back for the third patient. This is how you have to do. Then I don't know how practically possible it is. Like, I don't know, every setup is different, but you have to somehow manage your health as well, give some priority. And then alternate heavy and light calculus patients with a very flexible scheduling system. Anyway, this is very, very possible in dentistry, I feel, because you pre-fix the patients. So you can do that. And wearing the procedures, any procedures which is, very long procedures, keep it one, then take some. So all the scheduling you have to do, and shortening the patient's recall intervals. So this is basic things, but a great impact. Can somebody tell me what is this? Like, I do not know if this setup exists in India, or do you have it? I'm not sure, so I'm asking you guys.
This is a dental lab for the lab
These
procedures.
setups are there in, ma'am. Do you have the setups in Bangalore,
Some
India?
clinics
Like,
do have, some do outsource it. And also a
okay,
reminder, Zubiya, we have 7 minutes to go. If you want to
okay,
continue it in second session also, just a reminder.
yes,
Yeah.
yes, yes. So this is a prosthesis lab. So now, um, when you can see this lab, you have very, beautifully equipped, equipment, very handily available. The lights are directly focused. You do not have to do anything. So There is also, see, working in a very optimized ergonomic posture. You have a forearm support where the dentist is towards the thing. Then there is central workpiece support. It is ventilated properly. Then there is the table, which is overhead lighting, as I told you, magnifying lens, and a drilling speed control, which is operated with the dentist knee. Okay. Now this is impact on dental professionals. What is the impact of, beyond physical health for ergonomics? If you have to, it is reducing your fatigue.
Excuse me,
Okay.
Zubiya.
Yes, yes.
We have 6 more minutes to end the session.
You want me to join the other one?
Will you
Because it's
able to
not going
finish
to.
in this one, or you need one more session?
No, I think I have some more slides. Yeah, I cannot finish in 6 minutes.
Okay.
Yeah. Let me continue, and then maybe I can
Yeah, yeah,
join this
yeah.
evening. Okay. So your impact on dental professionals is to reduce your fatigue. You have to lower your burnout rates, okay, so that you have a healthier working environment, and your career longevity also increases with your ergonomic improvement, and your improved precision, so that the more you exhaust yourself, the more you will, create errors, possibly. So the more enhanced focus if you have breaks and comfort. Then moving to the next thing, what does ergonomic do in patient care? No? So it is patient comfort. You will enhance the patient comfort. You have treatment quality is increased, which you definitely it will happen. Reduced treatment time will increase faster procedures if you do, and it will create also a safer environment when you are completely focused and you're not exhausted. So these are ergonomic solutions for postures and techniques. So beyond equipments, and we have talked about tools, we have talked about the environment, we have talked about the lighting and all. Now coming back to the dentist, how are the correct postures you have to adapt? What are the techniques that you are going to use for a longer term ergonomic health? So how will you integrate all of this in your daily routine? When it comes to neutral postures, everybody will consider what is a neutral posture, what is the right posture that for my body it has to be. Okay, so it's like maintaining your different spinal curves. Will you be able to maintain the spinal curve for completely? I'm only not able to sit straight for such a long time. Will I be able to? You will also not be able to do. But we should train ourselves in position that when we are doing some movement, we have to, have that consciously, that okay, I have to come back, I have to do some movement, I have to take a walk, maybe I have to stretch something. So all these things you have to include inside your clinical practice, so that it doesn't affect you. And then optimal working distance, when your eye and your patient's oral cavity is there, this is 35 to 40 centimeters has to be. You're not measuring it, you will not know how much, but according to your, once you get experience and you're realizing how much you can go, is how you will correct yourself. You will reduce your eye strain. You do not have to completely forward lean. That is more important. And then your indirect vision, where you are going to use, not going to focus completely inside, you're going to use mirrors, and so that you can avoid twisting your toes. I've seen a lot of dentists who are either lateral side, who are completely cross, their legs are somewhere, their spine is rotated, the entire body, they just want to do the procedure. The patient is relaxed, but the dentist is not relaxed, and they are doing it in a very wrong position because they are not trained, or they just want to get the work done. There's some malalignment. Okay, then micro breaks are very important. And then patient positioning. Adjust the patient chair for ideal access and visibility, minimizing the strain on the practitioner. How many minutes do I have, Dr. Deva?
2 more minutes to go. I have sent you a new
Okay, can we
link.
start with the next theme so that it doesn't break?
Yeah. Shall I stop this link and we go to the next?
Yeah, yeah. So that we can start. Yeah.
Yeah. Thank you, doctor.
హాస్టళ్ల నిర్మాణానికి నిధులు ఇవ్వాలని చంద్రబాబు ఆర్థిక మంత్రిని కోరారు. 2025-26 ఆర్థిక సంవత్సరం మెడికల్ కాలేజీల నిర్మాణానికి అనుసరిస్తున్న పీపీ
Can you see? I would want like how
Yes.
many, I do not know how many participants are there, but there'll be some amount of,
Sure, sure. You can start.
minute exercises. I would say that I would want you to try and let me know, like if you can open your videos and show it also, it's okay. If you're trying it just like that also, it's fine. But I would want somebody to interact. Maintaining joint health. Now, basically, everybody got to know that you have to change your tools, equipments, your environment, your decks, everything. But what have you do with your own body? So, how will you maintain your joint health? Now, everybody knows that you have to keep your posture right, but how? That's the question. And what is the actual, level, or maybe I would say, the criteria that you have to meet as a healthcare professional. So, for maintaining joint health, according to the American, Heart Health Association, any physical human being have to do 150 minutes of moderate intensity exercises in a week. It can be anything. You can do a cardio, you can do strength training, anything but it has to be 150 minutes. This is for everybody. It's not just related to any profession. So you have, as we know, 8 hours of sleep, then hydration for women and men. 2 to 3 days of a week has to be strength training, basically. Either you do a, leg day, your hand day, anything. It can be very minute. It doesn't have, when you come for strength training, the concept of people is gym, but I'm not telling it that you have to go to the gym. You can incorporate something which has to be done within your work day, or it can be done at the end of your work. Okay. And then daily stretch routine. This is very important for the people who are doing desk job workers, for dentist professionals, even for us. And then your breathing practices, because after COVID, a lot of dentists use PP equipments. Now also you guys have to use, double protection masks because you deal with the oral cavity. So your breathing practices also have to be very important. And stress management is really, really important because all the fields are really, exhausting. And then there is something called as movement snack, which I would like to teach you all. So now, anybody like who, if you can put your cameras, on and do it. This is something called a standing downward dog. So why I have put this here, there are a lot of movements, but this is something which you can do it in your, on your desk, on your treatment table, which everybody can do it. So if somebody can try and let me know if it is very easier to do or somebody is feeling any difficulty. Just like 2 minutes, if somebody could try and give me a feedback. This is not any age appropriate. Anybody can do it. You have a table, you just stand and you just have to bend down and come up. It looks easier. Does it look easier?
Yes, it's doable.
It's doable. Do
Yeah.
you feel any difficulty, or you feel like, some effort you're putting in your body?
I'm undergoing a tennis elbow, so yeah, of course, it's difficult for me now with the chronic pain. Yeah.
Okay. Fine, we'll go to the other thing. This might be easier for you also, ma'am.
Yes,
This is
yes.
just the stretch, like upper stretches where because you're going to use a lot your postures when you're treating a patient. If I have to show my postures, it'll be like always like this, like you're completely in a closed chest, a slouch posture, which is called like rounded shoulders. So this I wouldn't tell you to just do it like once in a day, even between the treatment. Like if you're finishing one patient is done and you have some time for the next patient, so you can just stretch yourself and maybe like hold it for 10 seconds and then come back. It can be this way also, just hold it for 10 seconds, come back, so that you can feel your behind the bones going together, then coming back to the same position. So this in between, if you keep doing it like maybe for 3 to 5 days, you can definitely see an impact that you're at least you're not feeling that heaviness and that tightness in your shoulder. So small bits where you can add and alter it. And this is scapula squeeze, the same thing, like, it is very evidently seen and very clear enough. So all of this, in somewhere you have to include in your daily, routine. So these are very, important things. Now, all of whoever is, present, you have to do a postural check. Like if somebody's sitting, how are you sitting? Are your feet onto the ground, or it's like one crossed other way? Mostly you will be in a very comfortable position. So consider when you are treating, your feet has to be onto the floor. Okay, I'll tell you how it has to be. I'll show you a picture. It's better. So this now we'll start from the head. Your your posture of your head, we call cervical spine. It has a natural curve, but when you're treating the patient, you will not know how much to bend. As we told, no, it's told to be 30 degrees. But how will you know? So whenever you're doing, even if you have to treat, after a certain point of time, maybe I would tell you after 15 minutes, you come back, you just do the neck movement, which is you can easily do with your mask and your everything up, and then again go back. This much time you can take for yourself. Next, you have to keep your your light, everything in a position that you do not have to focus so much that you have to go completely inside the oral cavity. Okay. And then your wrist has, when you're doing some wrist movement, it's not important for you to always hold it in the same position. Neutral position of the wrist is like this. Okay, it's not completely like this, it's little bit like this. This is the actual position where you can easily do it. So how long can you hold this position? You can't. So after some time, break the movement where you can do some free movements, come back. You can do finger, movements, come back to the position so that you are not going to do the same movement and strain your wrist again. Because it's not just this movement, whether you're doing this movement, but it's going to impact you here, then it's going to impact you here after some days. And then that's how it keeps increasing. And from the muscle, it goes to your bone, and from the bone, it goes to your nerve. That's how it gets worse in the body, human body. So then I hope this is clear. Any doubts you can ask me.
No, basically, what we're
And
trying
then,
to say is every action should be reversed. Any posture,
yes,
yeah. So
should
it
not be constant for a longer duration of time.
just has to be the
Anything.
opposite motion of what is the regular work motion you're telling.
Yes, yes. For example, if you can give me an example, ma'am, like something if you're using, I will tell you what can be the thing that you can
Like you were
rectify.
just telling about the stretches, right? So basically, when we are,
Yes,
so I understand. So every action should have an
yes,
opposite,
yes. For
stretch.
example, if you're slouching like this and you're
Yes.
doing it for a longer time, then you have to stretch this muscle. So it
Mm,
has to be opposite.
got it.
I hope I'm correct.
Yes.
Okay, you have got me, no? Like that. So it's like each muscle. This is very basic thing that I'm telling you to cover the larger area, but they are stretches for each particular muscle which is affected individual to individual. For example, if you have told me that you have tennis elbow, then I would tell you stretching now will give you more pain because you have to stay in resting position for
Agreed.
certain amount of time. So that is depending, I will get to know better if it is one to one
Yeah, of
that
course.
I can be.
Of course.
Now, this is only for people so that you don't, this is preventing stage, whatever I'm telling, so that you do not reach to a patient stage. Then
Yeah, of
maintaining
course,
the,
inflammation you can't be doing, you shouldn't be doing.
yes,
That's a
you
great
shouldn't be
advice,
doing.
actually.
Because there is a misconception, no, that once you stretch, you feel good, but after stretches, because it's getting pulled and you get that pleasure pain, but it's not good to do it in inflammation.
Of course.
That is one thing. In all the spines, no, when you're doing it, it's told, how this picture is there. Exactly, our spine is like that only. But you cannot maintain it like that. Now I'm sitting for a certain, I'm only changing my position so many times. I'm only not able to maintain it. So when you're treating, you will definitely not have that conscious mind how much you have to keep, how much your lumbar should be, your torso should be bent. So it's consciously not, even if you have learned it, you have practiced it, you are hearing me, maybe for 1 week you will remember that this much degree only you have to bend. But after that, eventually you will forget. So this is like individual to individual, and between the treatment, you have to break the movements. That's the only way that you will prevent your body from straining your for a longer period of time. Then your arms have to be relaxed at the sides. Your elbows have to be close to the body whenever you're doing your movements are very precise. So definitely, but depending on if they're very youngsters who are there in your field, they just want to they'll be very keen in doing the procedure. They will not know what they are doing with their body. There'll be a person who will be very short heighted, but they will elongate themselves so that they can see very clearly. They will not have that conscious of mind that they have to first adjust the light and then let them use some mirrors or something. They'll just exert more of themselves. So all of this is important to educate in a very earlier stage so that you do not land up into getting any of the further conditions. Then your shoulders should always be over your hips, not elevated. Because when you're doing the procedures, even if one side, because right hand is more dominant, so when you're doing something, you will not focus. You're like I'm telling the level of dedication. So you keep doing that, and it automatically goes. So you cannot rectify it then and there. When what you have to do is you have to come back, relax, re-educate yourself that your shoulder is going up. You can go down, you can put the patient up, or you can lower your chair and do it in the most easy and functionable position possible. And then your seat height, as I told you, when I told you the seat height is according to dentist height. I've seen very tall people who are sitting and then the torso is very long, their legs are completely out like this, okay? But no, you cannot keep your legs completely straight like that and do any of the treatment. You have to have a 90-90 position from your hip, your knee, and your body. So only then you will be able to maintain. Somewhere, maybe if you have to go more deeper or you have to have a greater focus, that time I would suggest you to increase your height and then come back. But same posture for more than 15 to 20 minutes, depending on your capacity, it's not good. And then your stool tilted slightly forward so that you have a better focus, and your feet has to be always flat onto the floor. And then placing the pedal with 90 to 100-degree knee angle so that you don't have to go completely far and do that and have your knees like that, or like it has to be not placed too far. You should not lean or twist, so that, because your low back is more concerned when it comes to your shoulder and your wrist. These are the major point. And then you have to alternate your sides to avoid repetitive strain. Even if you're right dominant, you can not always be on the right side of the patient and do the procedures. Either you should be behind. This is the ideal position, that your patient is almost in on your left position, and you're behind the position, behind the patient, sorry, the patient bed. So that is the ideal most position. But depending on the your available range, you can keep shifting the postures, but not to adapt the same thing. This is the ideal thing. Now, everybody will, there's a point of time when you will think that it's just a pain. You have to take either painkillers, either you take a hot pack or you take a cold pack, and then you go back to your position. There's so many people whom I see, they take some amount of stretches, they take, maybe some painkillers or something, and those, what do you call it? Patches of pain relieving patches, and then they go back to the work. But after some time, they get, spinal changes, curvature changes. It leads to the nerve problems also. So when do you have to actually meet physiotherapist, the first contact person for you, then taking the on-counter drugs, being a diclofenac is for strengthening. You feel that you are, after working for a certain amount of time, you're feeling weak, you are getting hand pain, neck pain, any kind of pain. That is your sign that you have to get it consulted. Not wait until it becomes something inflammatory or something, worsening. So what do we do is, you have to strengthening program, your flexibility program, okay? And then you will get to know what is the gradual, and some people will get it sudden when you do a jerky movement or something, you will get, and it will be sudden. But for some people, for a longer duration of time, it's like slow poisoning type, it will become like that. So anytime you feel like pins and needles and tingling and numbness, then you have to consider that it has something improved. It has increased more than the muscles. Your nerve is getting involved. It is more worsened. That means it is a red flag that you have to get it checked. Then, if there is any sudden onset of weakness and your grip strength, which is very important for your profession, is getting reduced, is when you have to get it contacted. And then, if your range of movement is reduced, initially you were able to do this movement, you were easily able to do that, but now even moving this is painful. You feel some restriction. That is your sign. These are my references. So what do we conclude is ergonomics in dentistry is not just about, how, since I told you a very lot of equipments, without knowing the expenses, they might be expensive, but it has to be a very crucial investment in the longevity and well-being of your profession. It is also very important to sustain your, career, so that you, along with the patient outcome also should increase, and you have to also have your pain-free plus giving the patient pain-free treatment, and your productivity has to be there. This is globally as well. So you have
Correct.
to prioritize ergonomic principles for a pain-free, productive future. Anybody who has any doubts can please ask me. I think there is also, like, I don't know if the person is available to play the audio as a, no, I wouldn't call her a patient, but she has undergone physiotherapy. So I would want to tell her to give her feedback of how it was. Are you there, Dr. Sadia?
Can you tell me her name?
I
Yes,
think
yes,
she's
good
there.
evening. Can everyone hear me?
Yeah, you can tell.
Yeah, we can hear.
Actually, I'm a general dentist, practicing almost since 2 years now. Dr. Sadia here, and I want to share my experience regarding my ergonomics and my posture and how it has affected me through the long run or throughout my practice. So now I have been practicing almost since 2 years now. But as a beginner, how most of us do is just we just focus on the skills and getting more hands on as we graduate. And same thing I did, but little did I know, just I would just lay flat on my back one day and gaining that excruciating pain, suffering from lot of days. I faced the same thing, and then that happened only with 7 months into the internship. And the cause was my improper posture. Since the beginning I just didn't focus on my posture, and then I was just laying flat and crying, and it was so severe that I couldn't sit in a common normal position, sitting position. Then my friend Zubiya here, she was nearby, and I reached out to her, and then she just came out and examined me, and she told me that all my muscles were tightened and stiff, and just a quick 30 minutes of session, just a hand massage, healed me so greatly that in that same night I healed up to 70%. And then suffering from so many days and just a 30-minute session, I was just amazed. So then I realized what is the importance of posture and what is the importance of reaching your physiotherapist and what is the correct treatment and on in the correct time. But now again 2 years down the line, again into square back to zero. Same same negligence, same improper posture, and again now my neck is going into a toss. This all happens, we are very much focused into work. Same thing, same again back to zero. I would suggest my co-dentist, whenever we see our co-dentist practicing a wrong posture, just correct them. How my senior corrected me. She told me that she's into 25 plus years of practice now, but she never got such a pain, and my jaw literally dropped because I felt I was in internship and I had such a pain, but she was almost 25 years plus experience and never she got that pain. That is only because correct posture. And then I would request all the fresher pass outs to not be like me and practice your correct postures. And then I would recommend all the consultants or specialists consulting for long hours and just applying or taking the over counter drugs and just neglecting your health. When we are into correct posture and we are taking of care of ourselves, then only we can treat the patients and grow in our careers, and then we can look after ourselves and our families. So I would request everyone to just pause and think, this is the time we have to correct our postures and correct ourselves. So yeah, that's it. Thank you.
Thank you,
Thank you,
Sadia.
Sadia. Zubiya, there is a one question.
Yeah.
Can I read it out?
Don't know where to see it.
Due to the standing dentistry, hello.
Due to standing, okay, I can see, I think.
Due to the
Okay, you can read
standing
it out for me.
dentistry,
Yeah, 1 second.
I have started getting the ankle pain. So, is there any posture because
Studio. Okay,
of
I
the
would like to ask the person, Dr. Mush, okay, Mushraf Punnisa, why,
Mushraful Nisa?
how many like time do you stand? Like how long duration do you stand? Like is it more than 1 hour or something? Like how sooner do you get the pain? Like if you could unmute yourself and tell me. Are you there?
I think she was not available.
Okay.
Like, what is the minimum hours she can stand? Like,
See, I would tell, see, it depends. Again, it depends on how long she's been practicing and how severe her pain is and where her pain is. Okay, so if, like, for example, if I have to tell from an individual point of view, more than 45 minutes of standing, see, more than 30 minutes, you can't stand on both the legs. You will keep shifting your weight from one ankle to the other. Even if you have to stand, 45 minutes is maximum that you can stand. More than that, standing is not recommended. Yeah, I think she's there. Can you please
oh,
unmute yourself
she's
and tell?
yeah.
Do you My working. No, I'm not asking you how many hours do you work. I'm asking you, there's the only option that you have is standing only. Like if you can you have breaks in between where you can sit. I've never seen a dentist standing and treating, so I'm actually asking you. Yeah, I request you to please unmute. I have practiced standing for many years. Okay, considering your standing part only, I would tell you, like, if possible, if you can, keep a wider base of support. If you're standing, like, first of all, your footwear. I would suggest you to wear a good footwear, which is very, very comfortable for you and not any heels or flats. Second thing, Second thing I would tell you, considering your standing, I'm telling you. Second thing I would tell you to increase your base of support. If you're standing with, lesser, if you're considering this as your 2 feet, you have to stand with a bigger base of support. And I would tell you, after some time, one leg, if you have a stand or a stool, keep one leg on the stool and one leg down. So this is how you can alter it. Then standing completely on one side and legs to closer together. So what this can improvise is you are not going to lessen your gravity. Your center of gravity will increase. Your base of support will increase. Your pressure on only one side of the leg will will decrease. So you will pressure both the sides. So both the sides you can balance. This is how you can avoid getting pain. Now, if you already have a pain which is unbearable, then you definitely have to do some, stretching, exercises. If you could contact any of the physiotherapists, if you know, or you can contact me where I can assess you and tell you like how to overcome the stretching or strengthening, since I'm not able to talk to you here. So I'm this you can do in standing. You can avoid and alter this thing and try doing that. Okay, once you do this, you can definitely give me your feedback and we will look into it anytime in future. So if it is only standing, if you have
Thank you.
option, just try this and let me know. Anything else, I would be happy
Zubiya,
to
I
hear.
have a question, actually, not question, I need one advice. Like,
Okay.
what advice would you give to dental students or the professionals to protect their bodies earlier in their career before hampering their bodies? What precaution they can take?
What caution you can take? Okay. If I would tell, like I think 17 or 18 years you get into dentistry. I do not know in first year what is your program, but I have seen even if you're in your second year or third year, you already start you have some certain amount of quotas where you have to finish certain patients and certain things. So all that keeping aside, I would tell you to have a at least 30 minutes of regimen where or a program where you do every day. Okay. It's not important that you have to go to the gym. It's not important you have to lift weights. Something very minimally. If, for example, if I have to consider you, Dr. Teba, you being very lean, okay, considering that, maybe you feel a certain part of the body you have pain, or after a certain point you get, because you carry
Yes.
a lot of heavy bags, I will consider shoulder pain. I will tell you some stretches, okay, some 15 or 20 stretches, like 15 to 20 seconds that you can do, and divide it, maybe one for shoulder, one for hands, one for arm, depending on your particular pain. Okay, considering you having a tight shoulder because of holding back, I will tell the thing what I thought, the this is called pec stretch. These are the pectoral muscles. You're going to do this. Do it 3 times or 5 times. Hold it for 15 to 20 seconds and come back. This will stretch your upper body. Then they are after stretching. So it's like basically improving on your range. Okay, I will tell you to do all the shoulder curls, maybe this and the other way around. Okay, this is the movement. Second, I will tell you for doing stretches. You're never supposed to do stretching on cold muscles. That is your cold body. I'm sitting for a longer time and then that suddenly start stretching. It's the very wrong concept. Okay, you have to warm up your body. It's called warm up, strengthening, stretching, strengthening, and then again cool down. So that's how an exercise program goes on for everybody, no matter how it is. So it's like individualized shoulder. I cannot tell you one particular thing for everybody to follow, because everybody have different problems. So if I have to tell you one thing where I would tell you, start with some amount of, strengthening, some amount of stretching exercises every day, maybe 2 to 3, whichever depending on your joint. And then that's how you will improvise. And it has to go on. You have to have consistency. Like how Dr. Sadia told now, she did everything possible that I taught her through videos and, through video call. And then she followed it. But again, it's a human body. Once you keep practicing and then you are again straining it. So obviously you will come back to the same position. It's once you treat it and you leave it, it's not going to stay back over. So anything that you can do, even if it is neck movement, the basic thing, if I have to teach you one thing, your neck, no, the chin, everybody, what you can do is, if I have to show it in the sideways, I wouldn't tell you to do this. Okay, when you're doing the neck movement, this is neck movement. But when you're long time focusing and all, this is something called as chin tucks. Okay, so your chin, you have to take it in. Like you will directly feel it on your neck when you take it correctly. It's not going down, it's not going up, it's completely going inside. Can you try and feel it? Like you're going to feel it in the cervical spine. So like you're correcting your posture. You can try, Taiba.
Yeah. It's you can
You
Yeah,
will
feel.
feel it. There is a hit here
Yes.
when you do it correctly. So that is called as chin tucks. You're going to tuck your chin in, hold it for 5 to 10 seconds. So this is basically for all the people, not just the dentists, even the people who use a lot of screen and laptop and phones. Every time you just do this in your daily routine, include it maybe 5 to 10 times. That time you will feel that your cervical spine is getting it. So like this minute things are there depending on each problem where we alter it and give it to individual patients. So that's how you can do it. I hope I have answered you. Which is better,
yeah.
standing or sitting? See, I wouldn't, Dr. Firdaus, there is no better standing or sitting as a position. I would tell you, because it's again, you cannot sit in the same position for a longer duration of time. See, from according to the studies, no, if you sit for more than 40 minutes, and anybody minimum of 40 minutes, it's considered equal to smoking. Okay, like whoever. And our profession is like we sit for such a long time when you're consulting. Like if one procedure you're doing 30 to 40 minutes minimum, you will sit. So it's like after that you have to take a walk. That is very important. So that's why I told you, because of this only, diaphragmatic breathing that I told you, breathing is really important to incorporate in everybody's life. So there is no better sitting or standing. You sit for a longer time, you have to get up and walk. You stand for a longer time, you have to sit down and relax. That's the only way you are going to alter your position. I hope, Dr. Firdaus, I'm clear.
Is there any doubts or questions anybody has to ask yet?
Yeah. If anybody, I'm always open
Like,
to answer your questions.
I think the questions are over. Thank you so
Elbow
much, Zubiya, for such an
suspension.
informative.
Thank you. What is
Elbow
elbow suspension?
suspension, any damage?
What is elbow suspension? I'm like, if
We
you could
have freehand
explain.
suspensions when we are working. Our elbows are
Oh,
constantly suspended. We do not rest our elbows most of the time. In few of the fine works. So is the
okay.
thing
It
which we
it requires you to keep your elbows up.
suspended. Yeah, of course.
Okay.
Especially for
You
the
do not
front
any you
region.
okay. You do not have any support where you can keep your
So there are
elbow and do.
few regions in the oral cavity where we cannot, especially in the
Okay.
front, the anterior regions.
Oh,
So
okay.
especially the orthodontist, my
Okay.
consultant had pointed out, since his elbows are always suspended, he gets prone to a
Hmm.
lot of issues.
What is the duration of this treatment, ma'am? Like how
That's
long you have
because
to keep?
they're back to back so many cases, and constantly
Okay.
his elbows are suspended. So unlike us, where
Okay.
we are resting, like if you consider other specialties in dentistry, we have an
Hmm.
elbow rest. So when they start doing something, they do not have an elbow rest. So is there
Okay.
something for them? Because you've spoken
How
about
long does this treatment go for one patient?
roughly around 15 to 20 minutes, any patient.
15 to 20 minutes, one patient.
Yeah.
Okay. Can you break the treatment down? Is
Yeah,
it possible?
I think that could be
That is
suggested.
one thing.
Yeah.
Breaking the treatment down, I will tell you, like how I told you, like you're doing something, your gravity is pulling, you're going down, come back.
Yeah.
This is prevention.
Yeah.
Treatment, if you have already got it, I would tell you to strengthen your elbows. Okay.
Okay.
If you already have pain, then you can, if it is acute pain,
Of
which
course,
which
of
can be
course.
maybe
Yeah.
1 to 6 weeks, you can keep ice pack to reduce your pain as of now. If you want to strengthen your pain, all these minute muscles, if I have to tell you one easy exercise, just take according to your tolerance, maybe 500 ml water bottle or something. And then if this is the resting hand, like I'm resting my forearm on the table, my wrist is outside the table. So just do the bottle movement. Just bend your wrist, flex your wrist, extend your wrist. Okay, this is going to strengthen this and this muscle as well. Very, like, if I have to tell you something for direct treatment, I would suggest that you can try out and let me know
Yeah.
how it
I've
works
been
for you.
trying out that. I'm finding it quite difficult. I'm gradually increasing the weight.
Okay.
That's a
But with the
lessons
pain, I
learned
wouldn't
part.
suggest you to
Yeah,
increase the weight
of
now.
course. I understand. I'm being advised to, like, yeah. So
Well, I would
this
suggest
is
you
for
to
the
take,
people who are
just
listening,
yes,
lessons learned
yeah,
hard. But any muscle in the body you'll appreciate only when you suffer. So literally, there's
yes,
nothing a dentist would want to suffer, because every muscle we are unknowingly, subconsciously, we are putting at
yes,
strain,
yeah.
and
I
that
would
is the
tell that,
lesson we learn
yeah,
every
you
each
guys
time.
are focusing on, it's
Yes.
like starting from here and
Yeah.
it goes till here. All of your muscles are compromised because you're using the entire
Yeah.
arm,
Yeah.
and then I think the entire body is in
Yeah,
contact
of
when you treat
course,
the
because
patient, not the
the
other way.
spine
Yeah.
itself goes for a toss
Yes.
at times. So yeah, there's
Yeah.
nothing which is spared. Though we focus so much on
Yes.
hand, wrist, elbow, shoulder, neck,
Very precise movements you
spine.
do.
I mean, there's everything. So I guess that's why the
Yeah.
seminar becomes very important. This is for
Yes.
everybody who's
There are, see, preventions I have taught you. I hope that,
practicing.
you have to keep reminding yourself to, everywhere prevent it some or the other way possible.
Yeah.
If you have already got the pain, I would tell you to, definitely consult a physiotherapist, even if you're not undergoing any, treatment, where we give electrical modalities, but there are techniques and exercises where, just by educating, just by coming into one-to-one contact, getting appointment with any of the physiotherapists, where they can they can see you, make you do the movement, like if, for example, how Tayaba showed the movement. So if I see like that, then I will know how much range you're getting affected, and that's how it will get tailored according to your needs. So it is really important when you are already suffering to get into contact. If you are in that stage where you've just started, prevention is the best cure.
Dr. Taiba, if we can have your contact details on the screen, where we could contact you online or in person, your details.
Yes, on definitely, ma'am. I
Yeah.
know if Dr. Taiba could display it, I don't know.
Ma'am, I'll share in the group, ma'am.
Yeah, yeah,
I'll
sure, sure.
share her contact number and everything.
Okay. Yeah. Thank you
You
so
can
much.
definitely contact me through WhatsApp or any mail also for one-on-one sessions, where it's online sessions definitely, because everybody is busy. So it's online sessions wherever we can contact, one-on-one consultation basis also, definitely to tailor it according to yourself. Anytime available.
Okay. That's a great learning
Is
today.
there any queries or any doubts?
Definitely, please. We have 6 minutes. So anybody who is there in the meeting.
There is a chat actually. No. Okay, so we'll wind up this session, Zubiya.
Yeah, yeah. Fine. Thank you so
So
much
thank
for
you
having me.
so
I hope
thank you
it was
so much.
very productive and it makes some impact in your working profession.
Definitely. It is really helpful it is really informative, insightful session for all
Thank
of us. Thank you so much.
you. You're
Doctor,
most welcome.
add a point. Some doctor wants to add a point, I guess.
Who, ma'am?
Dr. S.
Assalamu alaikum. Um,
Walaikum salam.
Assalamu alaikum. I'm Dr. Sharif here.
Okay.
Doctor, the session was very eye-opener actually. Thanks for this section. And
Thank you so much.
most neglected thing is like vitamin D. Most of
Hmm.
them, like I heard one of the sisters saying that heel pain. So it's not only the posture which can cause this, but we need to analyze that where we are going wrong. Sometimes
Nutritional
the
effect. Yes.
calcium metabolism or calcium
Yes.
and even the vitamin D. Though we take calcium supplements, if we neglect vitamin D3, definitely there
Hmm.
are things which we can't even
Yes.
imagine. For
Yeah, because
example, I know one of my
humans.
friend
Yeah.
who suffered extra bone growth into the canal, vertebral canal, that was impinging
Okay.
on the spinal cord. He too is a
Yeah.
dentist. Uh, due to bad posture actually,
Mm-hmm.
and even this fluoride containing water, like the mineral water, what we take from the cans,
Mm-hmm.
right?
Mm-hmm.
That has calcium plus fluoride. It has given him the extra bone growth.
So it
So he's
converted
undergoing
into
surgery
bamboo
now.
spine.
Yeah.
They've got spondylitis. Yeah,
So
that is
I
also
think overall
nutritional
we
point of
need
view.
to
Yes.
analyze.
Yeah, when we do that's what I told you. When we do a one-on-one, consultation, we will look into everything, whether it's just the posture which is causing you, how long it has been. Your duration of pain also matters a lot. If it's just 3 to 3
Yeah.
weeks or 3 months, it's acute pain. But if you have been working for a longer duration of time, then your nutrition comes into, especially for, females who, Muslim females, I would tell, in the hijabis who have very less exposure to the sun, vitamin D deficiencies are a major cause. Everybody will face it definitely in their life. So all of this have to be considered. It is a very great point that you told. Anything else? You have generalized when it comes to deficiencies, no nutritional deficiencies. After the entire day, you have that generalized pain in your joints. You feel that weakness at the end of the day. So that's a really good, great sign that you get to know that there is something wrong. Nutritional deficiencies. That's one thing. Self-experienced.
Then
So
thank you, Zubiya.
we can end the session now, Dr. Taiba.
Yeah, sure. We can just wait for 1 more minute. If anybody has any
Okay.
doubts,
Sure,
then
sure.
we'll end.
Okay.
But the session was very informative, Zubiya. It's very informative. I
You.
got a lot of information regarding the poster and everything. Thank you so much.
Thank you. You're most welcome. Anybody who wants to ask anything, please feel free to ask. You can type in the chat box as well.
Okay, I think everybody got their answers because of your presentation itself is self-explanatory. Thank you so much.
Okay.
We'll
Can we
end.
end, ma'am? Dr. Vasya?
Thank you. Thank you so much, Zubi.
You're
Thank you.
most welcome.
Thank you, Taiba.
Thank you. Thank you, Zubiya.
You're most welcome.